Nursing Civil Rights, Gender and Race in the Army Nurse Corps. Teresa J. Thread writes about the struggles of professional black women and white men in nursing. Both black women and white men face sexist and racist obstacles in their attempts to become full-fledged members of the Army Nurse Corps. The ANC was all female. By the dominant separate but equal values and racist practices of the time, the ANC was constructed as white, except for temporary admittance of 18 African Americans during the 1918 influenza pandemic. Nursing went from a domestic and unpaid responsibility to paid work, tying in the role of war and the growth of hospitals to the social perception of nursing as women's work. African American nurses used gender as an argument for their inclusion into the ANC. This changed in 1944 when a severe shortage of nurses in both battle and civilian hospitals forced policy changes. The quotas for African American nurses were eliminated and helped alleviate the shortage, but most of these nurses were assigned to segregated hospitals. The threat of a draft of primarily white women nurses in 1945 through the Nurse Draft Bill pushed the Army to open Nurse Corps as public sentiment overwhelmingly favored inclusion of all nurses, with the exception of men. Male nurses were denied nursing roles during World War II and were assigned as corpsmen or medical technicians, and they only began to break the gender barrier in 1955 via an amendment to the 1947 Army-Navy Nurse Act. Female nurses feared encroachment on their domain in the Corps and actively resisted the inclusion of men. Although men were admitted to the membership in the American Nurse Association beginning in 1930. The military hierarchy was not allowed by denying ranks to nurses. African American nurses and male nurses did not join forces or efforts. African American nurses were better organized than the male nurses. They used the argument that women were naturally best suited for nursing roles. These arguments resonated with the military leadership and the public, who believed that gender rather than race determined who should care for soldiers during World War II and into the 1950s. President Harry Truman allowed the inclusion of African American women in the Army Nurse Corps, but did not specify for the inclusion of men. Even so, African American nurses continued to face individual discrimination in their assignments. Men made little progress towards entry and equality in the Nurse Corps. Even as the American Nurse Association eased entry of African American women and men into the organization, the military continued to operate under traditional gendered notions of nursing. Women officers were a major obstacle. Women had created a place for dominance and control in the Corps and feared the inclusion of men might alter their authority and expose them to the workplace inequality they experienced in society. Perceptions of the role of nurses in the military changed in the 1960s, reshaping the way the Army provided care to its soldiers. Pragmatically responding to military nursing shortages, particularly during the mid-1960s, as President Lyndon Johnson fed more troops into Vietnam, the Army increasingly recruited all nurses. The Army was a reluctant leader in integration, moving towards inclusiveness only when forced by presidential order, legislation, or shortages. Even so, as men moved into the Army Nurse Corps, they faced different hurdles to advancement, officer status, and assignments. Men also received different privileges than women, receiving housing allowances for families and being allowed to marry. Men were allowed assignments to units in action, which positioned them for faster promotion through the ranks. The American Nurse Association moved at a faster pace and more deliberate into integration. By the mid-1950s, the ANA policies reflected inclusiveness in terms of race, religion, and gender. This book discussed history as pedagogy, evidence, and explanation. History as pedagogy. Studying the history of nursing provides students with a realistic understanding of nursing and what has influenced past developments to bring us to the present situation. This book discusses the military nursing as promoting the formalization of nursing practice. Male nurses were only trained to work in asylums and psychiatric hospitals due to the violent and custodial nature of the work. The lack of uniform training between men and women was due to a perceived biological incapability. History as evidence. According to Stevens, to affect better patient outcomes, new knowledge must be transformed into clinically useful forms, effectively implemented across the entire care team within a system context and measured in terms of meaningful impact on performance and health outcomes. But discrimination and its effects resulted in deficient health care for all Americans, including minorities. According to the ANA, once this was shown with evidence, they discovered that the diversity of their members made them smarter as an organization and stronger as a core. History as explanation. Understanding history will help strengthen nursing, identify our ability to contribute effectively to the ongoing challenges of promoting the health care that the present and future expect. In this book, it's discussed that monks and laymen took care of men in hospitals, while nuns and the traditional midwife cared for women in hospitals and homes. The decline in men's participation and leadership in nursing was due to a decrease in monasteries, but an increase in convents, with nuns taking on the religious responsibility of caring for the sick. The Industrial Revolution saw a growth of factories and jobs that employers deemed appropriate for men only. These jobs were higher paying.